When I graduated, it was May of 2018. My first job was in a cardiac step-down, which I loved. Going into 2020, of course, we were nearing the pandemic. I kind of remembered when I was a student thinking that I would like to teach at some point. I had really great connections with all my clinical instructors at the time, and I just really admired them. I reached out to the previous director about teaching. At that point, I only had about 2 years of experience. Reached out to a professor, former professor. She told me I had to have at least 3 years, and then about the day that I hit that 3-year mark, she gave me a call and asked if I'd be interested in being an adjunct professor. So that's kind of how I got my start teaching. Being an alumni, it allows me to know what the students are capable of. I know that this is a tough program. It's 16 months of constant studying and stress and sacrificing. I also can empathize with them. I try to give grace. So I try to fairly kind of distribute where I give grace and where I know I can push my students. The relationship that Marian has with the Ascension hospitals, I think, is particularly beneficial compared to a lot of schools. The students get to know the staff in all of the Ascension hospitals here at St. Thomas, Midtown, and at St. Thomas West. The staff members start recognizing us really quickly, so they are able to form relationships faster than I think students with other schools can. They also have the nurse externship program that allows them to get their foot in the door after they have had their first semester of classes. During that program, they're also allowed to shadow other units. They get exposure to patients. They learn how to do skills that a lot of new nurses coming out of school don't know how to do, but the people who work through those programs have a leg up over other programs. To be successful in this program, you do have to sacrifice. You need to be prepared to study 6 to 8 hours. This is kind of your full-time job while you're here. Being prepared to dedicate yourself to this 16 months. It feels long while you're in it, but time does fly, and before you know it, you're graduating and you're licensed and you're a nurse. The thing I'm most passionate about is skills development, and the 2 classes that I lead are primarily based on skills. I teach pharmacology and we do modules on medication administration. And then the other class that I teach is nursing fundamentals. So we teach Foley catheter insertion, IV and phlebotomy draws, place an NG tube. Those are all really fun and pertinent skills. As the class name suggests, they are kind of the fundamentals of bedside nursing. So when those students leave that class, they are prepared from a skills perspective to do a large portion of what other nurses will do at the bedside. And fortunately, they have the opportunities in a lot of their clinicals. I do just really like this job. I work with an amazing group, primarily women. For the students too, I do just really enjoy spending time with them and seeing them make those connections from them coming into my first semester and developing those skills, and then in Med-Surg 1 and Med-Surg 2 and in their immersion course, getting to utilize those skills. So I find that really motivating.